Hello and welcome, dear learners, professionals, and students, to the very interesting topic on dissolution testing. The topic is why dissolution testing should be product specific. In simple words, why every product has different and specific dissolution testing conditions. So, first of all, we have to understand why multiple strengths of the formulations are there. Sometimes the same API is there and it is available in the multiple formulation and different formulation designs. So these formulations of different strengths are manufactured or strengths are made by considering the dosing regimens, patient population, and the disease conditions. So different population of the patients and different disease conditions require different dosing regimens. So different strains are to be made. Then different strains are also manufactured for different indications, like different patient population, disease conditions. There are different indications for individual strains also. Then sometimes the tablets have break lines or functional scoring for dose divisions. That means the tablet of higher dose is manufactured and a score line is given onto the tablet so that the patients can divide and take the tablet. So same drug substance may be available in different formulations. Now see, many times we observe that the same drug substance is there and it is available in different formulations like tablets, hard capsules or hard gelatin capsules, then soft gelatin capsules or soft capsules, solutions, suspension, and many more. Also, some drugs are available for different routes of administration, but in this session, we will consider only the oral route and why the specific dissolution testing conditions are required for each of the formulations and why each product has specific dissolution conditions. Then some drug may be available in different salt forms, polymorphic forms, PhDs. PhDs means different particle size distributions, formulation designs like IR, that is immediate release, ER, that is extended release or modified release. Sometimes these are available in the delayed release, effervescent tablets, and or in combination with the other drugs. Some drugs are available as a base and the salt form is also available for that same drug. Then different polymorphic forms are available. So every API may exist in some polymorphic forms, salt forms, crystal forms, or particle sizes. And all these are the factors affecting onto the product specificity. That is the dosing regimen, patient population, disease conditions, indications, and that product design. So there are multiple strengths or multiple formulations available, and same API also have different particle sizes, salt forms, polymorphic forms, and formulations. See here, I am taking an example of diclofenac sodium. Diclofenac sodium is available. Diclofenac potassium is available. The plain diclofenac base is also available, and it is available in multiple formulations. Here I have enlisted some of the formulations. This information is taken from the OGD, that is FDA information for dissolution. So diclofenac is available in capsule formulation, It is available in diclofenac potassium form, diclofenac sodium form, and it is also available with the other drug, that is misoprostol. Here it is delayed release. The formulation design is delayed release. So for diclofenac plain capsule, basket 1 is used at 100 rpm, and medium contains the SLS or SDS. This is the media. Then if you come for powder for oral solution, the testing conditions are different. You can check this information in the orange book and OGD dissolution media. Then diclofenac potassium capsule is available. So here is also capsule, here is also capsule. Here is basket, here is paddle. 100 rpm, this is 50 rpm. Here sodium dodecyl sulfate, that is SLS is used, while here SLS is not used. The volume is same and the time points are same. Now you can clearly understand this is base and it is having less solubility. That's why sodium lauryl sulfate or sodium dodecyl sulfate might be used. But here the solubility might be increased due to this salt form, and that's why there is no SLS into the formulation. So the dissolution is formulation specific, or these conditions are product specific. Then coming to tablet formulation, it has also different media. Then diclofenac sodium extended release tablet is also available. That is having the dissolution apparatus of paddle at 50 rpm. Then medium of PS 7.5 and the extended release profile of 24 hours is there. That's why it is a different dissolution condition. Then diclofenac sodium and misoprostol enteric coated tablets are there. These are delayed release tablets. That's why a delayed release dissolution requirement is there, and based on that the dissolution stages are there, acid stage and the buffer stage. Then another example is for cabozantinib capsules and tablets. So cabozantinib is a anti-cancer molecule and it is available in capsule formulation and in tablet formulation. So here you can see with sinker, because of capsule formulation, here speed is 75 rpm, here also 75 rpm, medium is 0.01 normal SCL, here also media is same, but you can check the difference of surfactant level. Here 0.5% surfactant for capsule formulation and 0.375% for tablet formulation. The time points are same and media volume is same. So there is a difference into the concentration of surfactant in the dissolution media. Then another example is enzalutamide capsule and tablet example. So enzalutamide is also a anti-cancer molecule for prostate cancer. It is available in soft gelatin capsule and in tablet formulation. So here sinker they have used, apparatus is same, speed is also same. Here medium is with two tires, that is tire 1 dissolution medium, tire 2 dissolution medium. And because of this soft gelatin formulation, the pepsin is used as a enzyme to avoid effect of cross-linking on the dissolution or drug release. In tablet formulation, the media is phosphate buffer PS 7.5. Media volume is same and the time points are also same. So this is formulation dependent dissolution example. Then another examples you can find from the USP or BP and the other pharmacopoeias, and also from the US FDA's website for dissolutions. So why different dissolutions are required for different formulations? As we have discussed, every formulation is specific and every formulation has some specific design. That's why every formulation has different testing conditions for the dissolution test, because we cannot check the formulations or different formulations with the same method. Now, dissolution testing is always a product specific. That means every formulation has some different testing requirements. Dissolution depend on drug substance, formulation type, formulation design, and also depends on the excipients used in the formulation. Dissolution is also dependent on the strength of the formulation. Strength of the formulation means the amount of API in the formulation, or simply you can say a label claim. Generally, the lower strengths release the drug or dissolve faster. That's why the lower strengths are required to be tested, sometimes with the different specification and sometimes with the same specification. Then different dissolution method to be developed for each of the product with different acceptance criteria. That's why the requirement of different acceptance criteria is there. We cannot test the product or different products with the same method, or we cannot give the same acceptance criteria for dissolution for the different products. The dissolution method of other formulations with same drug substances can be referred or studied for starting the development. Now, the methods which are already available in the literature, those methods we can use as a starting point, or we can refer them in the literature, or we can refer them for starting the development. But every method should be specific as per the formulation and the API. Then why different dissolutions? Once again, we will discuss this topic in detail. Dissolution testing is a performance test for the product and important for its bioavailability and therapeutic effectiveness. See, dissolution method is not a simple method of testing like assay or water content like that, because the dissolution is a performance test and each product has different performance. So dissolution test should be specific. Then dissolution is important for the product's bioavailability and their therapeutic effectiveness. So different product cannot have or should not have the same dissolution testing conditions and the acceptance criteria. First of all, we will consider drug substance. Different drugs exist in different salt forms or solubility, then polymorphism and the particle size. If you consider a same drug, it may exist in different salt forms. Different salt forms have different solubilities, then different polymorphs, then different polymorphs have different solubilities and stabilities. Polymorphs also have different bioavailabilities, and the drug substances also exist in multiple particle sizes, and particle sizes also have impact on the dissolution and the bioavailability, and all these things affect the therapeutic effectiveness of the product. Then the second is formulation type. Formulations might be available or may be available of the same API in different designs like immediate release, extended release, delayed release, that might be available in uncoated, coated form, powder form, pellets form, and many more. So these formulation types are required to be considered while developing a dissolution method. Then formulation design. Now once again we can consider the formulation design as, for example, drug dissolved in soft gelatin formulation. Now in soft gelatin formulation, the drug is in the dissolved form. Drug may be converted to solid amorphous form to improve the solubility. So these formulations must have different dissolution testing conditions. Then some excipients are available in the API in the formulation, like surfactants, polymers, and these have impact on the dissolution and the drug release. Then the strength. Strength means the label claim. Lower strengths have fast dissolution, mainly for low soluble drugs. The same dissolution method cannot be discriminatory or biorelevant to the other products. And this is the very important point to consider. Each product has specific bioavailability and the clinical studies performed on its development phases. So, while developing a dissolution method, all these points are required to be considered. And that's why dissolution method is always product specific. So, for this, I have referred product labels, patient information leaflets, and the orange book. Then I have referred USP dissolution methods and OGD media. So thanks for watching this channel, and please like, share and comment on the video. The next video will be on the strain dependent dissolutions, in which we will discuss on to the dissolution and why it is dependent on the strains. Thank you for watching the video.